Hey, what's up guys? Welcome back to the upper hand. Today we're talking about neural flossing in the upper extremity, more specifically how to floss the radial nerve in your arm. Stick around because next we're going to talk about what exactly neural flossing is, why you might use it, and how to perform it. So neural flossing is an active assisted range of motion technique that you can use to sort of self-glide a nerve through its tract or its surrounding connective tissue in the upper extremity. Neural flossing can help to increase the blood flow to the particular nerve that you're flossing, and it can help to reduce or alleviate symptoms related to that nerve. You may use a neural flossing technique if you have some sort of nerve pathology, more proximally such as at the brachioplexus area of the shoulder, or if you have some sort of pathology or entrapment of the nerve more distally, such as at the elbow or at the wrist. Next, we're going to talk about how to perform radial nerve flossing in the arm. So in order to perform radial nerve flossing, you want to start with your elbow by your side at about 90 degrees of flexion, just like I have here, and you want to be palm down, just like this. Then you want to take your ring and small finger and drop it down slightly, and then hook over those two fingers with the fingers of your other hand, just like this. And the first part of this floss is you want to slowly bend your wrist down, allow your other hand to take this wrist down into flexion, just like this. Second part of the floss is you want to come into slight elbow extension. So you slowly straighten your elbow slightly, and then you would take that all back to the starting point. So wrist down, elbow slightly straight, and then take it back to the starting point. And the last component of this floss is to take the ear to the shoulder of the side that you're flossing, just like this. So you want to do that all in one smooth motion. So wrist down, elbow straight, cervical side bending here, and then take it back to the starting point. Wrist down, elbow straight, cervical side bending, back to the starting point. And I'm going to show you a side view of this particular floss so that you have a different perspective of it. So you can perform these neural flosses for about 30 to 60 seconds. They should just go slowly and steadily for about a 30 to 60 second session, and you can perform this 2 to 3 times a day or as prescribed by your therapist. When you're performing these neural flosses, you should not have pain. You may have a pulling or stretching sensation along the area of the arm or the hand that's supplied by the nerve that you're flossing, but you should not have pain. If you have pain or prolonged paresthesias, which is pins and needles, tingling, numbness that lasts after you're done flossing the nerve, then you should consult your therapist. And if your therapist is having a patient perform these neural flosses and they're having reproduction of pain or prolonged paresthesias, then that may merit further evaluation of the upper extremity to assess why this may be happening. So we hope this video was helpful for you, and if it was, be sure to check out our entire library of videos on the upper hand. We'll see you guys next time.